CataractCoach.com. The biggest challenges after fellowship. Two of our former residents explain what lies ahead for you. I recently had dinner with two of our former residents. Tripper Sauer, who is Jules Stein Eye Institute class of 2017, who then did a glaucoma fellowship in Boston, and David Reed, Jules Stein Eye Institute class of 2013, who did a 2-year surgical fellowship in retina at the Wills Eye Hospital in Philadelphia. And now they both practice there on the Cape of Massachusetts. And we got to talking over dinner, and we reminisced about the good times in residency, and I learned about how was their experience in fellowship. But more importantly, we talked about what was life like in the first couple of years after the culmination of your training. When you first get out into practice, what are the surprises and what are the challenges? And let me summarize the things that we talked about. The first thing is realizing that you have lifelong patients now. So certainly glaucoma patients require lifelong follow-up, and a lot of retina patients, those with diabetic retinopathy and those with macular degeneration, are going to have lifelong follow-up. So these are patients that you end up seeing on a routine or regular basis for many years and even many decades. So you really form close connections and relationships with these patients. And that's a surprise because when you do a residency of 3 or 4 years and a fellowship of 1 or 2 years, you don't really have that same kind of longitudinal follow-up over the course of a long span of time. Now, if you are like me and you do cataract and refractive surgery, you may not have that same outcome. In cataract and refractive surgery, it's almost more like catch and release where we do the surgery. Once I do your bilateral cataract surgery, let's say bilateral LASIK, you're done for life. My surgery will last you for sure the entirety of your life. 50 years at a minimum. And so the patients don't necessarily come back to see us. But keep that in mind depending on the fellowship that you do or the subspecialty that you choose. You may have lifelong patients, and that can be a really beautiful thing. They said there was a surprise the first time you're operating, and there's no professor or attending surgeon on your side to help bail you out of surgery, out of a tough situation. There's no one in clinic to say, hey, can I run a patient by you? Something unusual that I'm seeing here. So it's a little bit of a different experience when the buck stops here, as our saying goes, or you're the end of the line. You're responsible for everything for this patient, and no one's right next to you to bail you out. Patients can have very high expectations. Sometimes we're spoiled in residency because the patients that we tend to treat are very sweet, very understanding, and have very reasonable expectations. But you get in the private world, you may have patients who have unreasonable expectations. And it's not their fault, they just don't know any better. Good examples, we're talking to a patient about a MAC-off retinal detachment. And the patient had surgery and can achieve 20 out of 40 vision, which you and I both know as ophthalmologists, that's an amazing outcome. But the patient was upset. Well, when's it going to be 20/20? And when you explain that it's never going to be 20/20, it's a little bit of a shocker. Another thing is, when you do surgery, every patient expects perfection. Just imagine if you're a baseball player and you bat .350, or 35% of the time you're at bat you get a good hit, that's success. If you're a basketball player and you can shoot 95% from the free throw line, that's amazing, right? Well, if you're a surgeon, patients expect 100%. They don't want to be that 5% that has some issue or the 10% that had a problem. So you have to perform at a much higher level than you ever thought was possible. And remember this too, now that we're in the era of med schools going to pass-fail and no more grades, which patient ever said, hey doc, for my surgery, just do a passable job? Come on, you know it's ridiculous. Of course not. They all want perfection, and you have to hold yourself to a higher standard to deliver those incredible outcomes. And patients also want instant results. You and I both know that the results of surgery are half due to my surgical skill and my technique and the way we did the surgery and the instrumentation, and half due to the patient healing. You can't always predict the patient healing. You can't always modulate that either. And so patients have to have a little bit more reasonable expectations that sometimes the tissues don't respond in the way that we predict. Another one, my residents both agreed, as I've always told you, practice is much harder than your residency or fellowship training. Now, I'll be the first to admit, more than 20 years ago when I was a senior resident, I said to myself, I can't wait till I'm in private practice because it'll be so much easier than residency. It's laughable now. How naive was I? Because it's just the opposite. Practice is much harder than residency. Like I've told you before, you look back on and you'll say, residency and fellowship, they were like 11th grade. At the time when you were 15 or 16 years old in 11th grade with 6 AP classes, you thought it was really difficult. But now you look back and say, come on, 11th grade? It's a walk in the park. We say the same thing about residency and fellowship. It really is a walk in the park. You may have to now have other challenges in your practice to deal with. Remember, you're running a full business now. In residency and fellowship, you just treated the patients. But now you have to master the treating the patients, for sure, doing the surgery and giving those beautiful outcomes. You got to deal with other issues that you never thought about. Staffing issues, personnel issues, negotiating your lease, business issues. What's your profit and loss statement? How are you making your overhead? Running a whole business on top of that, and you may not have learned enough about business during your residency training program or fellowship, that becomes a heck of a challenge. Another thing we talked about, they were surprised that there's competition. You may think that if you finish your residency training program, that everyone's going to have an equal outcome. But that's the fallacy of the equal outcome. You'll have an equal opportunity, but you'll have to maximize those opportunities to achieve your best outcome. Every resident or fellow who finishes training is not going to go out and practice and do the same volume of surgery with the same level of success and the same level of revenue. It's not going to happen. I mean, think about it. Even in families where you have the identical parents and very similar genetics between siblings, you have the identical household, the identical opportunities, the identical schooling, identical everything. You don't have identical outcomes among all siblings. I mean, look at me. Among my siblings, arguably, I'm the least successful. As crazy as that sounds. So remember, when you get into practice, it is not equal outcome. It's equal opportunity. And it's up to you to make the outcome. There is an 80-20 rule that does apply to ophthalmology even. And that 80-20 rule is about 80% of the surgery is done by 20% of the surgeons. Now, you obviously love surgery because you study it here on CataractCoach. So make sure that you put in the hard work and effort to be that 20% of surgeons who's doing 80% of the surgery, because that's your passion. Work is so much harder than you think. Look at this picture right there. That's my car in my parking structure at my clinic yesterday. I was the first person in the entire building, which houses many different clinics and offices and practices. I arrived at 5:30 in the morning, and that's me leaving the parking garage at 7:30 at night. 14 hours in my clinic. I was the first person in the entire 6-story building to enter the parking structure, and I was the last person to leave. Now, that's just because I came back from vacation. I have a lot of work, but it's very routine for me to work a 12-hour day. That's not that big of a deal. And oftentimes they're 14 or even 16-hour days. That's a surprise. Much tougher than your residency training program. It takes about 5 years to hit your stride. It's really difficult in a private practice to start from zero and get busy overnight. And so you want to be a great ethical doctor. You want to treat from your heart, not your wallet. You use your brain, use your heart to treat patients. We always talked about this. Remember, give that golden rule. Give patients the same high level of care treatment that you'd want for your own eyes or for your family's eyes. That's the sure way of getting busy and being successful, but it does take time. And I estimate about 5 years. Don't expect to be hitting your stride before 5 years of time. Similarly, you may be surprised just how much your surgical skills advance in the first few years of practice. You learn a lot in residency and fellowship, even more, but you may go to even higher levels. In fact, you will in your first few years of practice. So don't stop learning. You've got to have that enthusiasm, that drive, that desire to keep learning more and more and more. And if the way you do surgery in 5 or 10 years in the future is the same as you're doing it now, you're making a mistake. You've got to keep evolving your skills, your techniques, your technologies. And then finally, the last thing that we left the dinner with, and probably the best take-home lesson, is that life is good. And we are living the dream. I am thankful every day that I'm an ophthalmologist. It is an incredible field. I'm so fortunate to be in it. And to have it be my passion is an added bonus. Now, sure, there are people we grew up with many years ago who pursued other avenues, Wall Street and private equity and hedge funds, who are making a multiple of our income. But it's not about the money. It's about the happiness and what we do and the passion we bring to it. And look at the magic we can do. We can literally make a blind person see. Patients are so grateful. It is a fantastic field, and I think you feel the same way. We are so thankful to be ophthalmologists. It is a blessing for us, and our patients are thrilled as well because we can give them the gift of sight. So in summary, I had a beautiful dinner with my 2 former residents. These guys are amazing. We're so proud of them. And the better they do in life, the better it makes us look here at UCLA. I want every one of my residents to surpass me and really achieve the best in whatever their dreams are. And I want the same for you guys on CataractCoach.com. Thanks. Thanks for watching these videos. Be sure to check out the website too, CataractCoach.com. You'll get the full text and the graphics and the photos plus the videos. And if you sign up for a free daily email, we'll send all of that to you in your inbox every day for free. Come on. CataractCoach.com. Check it out.